According to Professor Lucille Blumberg, malaria is a deadly and infectious disease that kills over 500,000 people in Africa each year. South Africans of all ages living or visiting certain regions in Limpopo, Mpumalanga and northern KZN are at risk. But Professor Blumberg says it is treatable. She joins us now to discuss how we can mitigate both long-term and short-term effects. Prof, a pleasure to have you on the program this afternoon. Now, malaria remains a significant global health concern. Professor Blumberg, could you provide an overview of this current malaria situation, also highlighting specific challenges and the affected regions here?
So, good afternoon, and thank you very much for highlighting malaria. So we have three regions in South Africa where malaria transmission may occur. As you mentioned, northeastern Limpopo, low-veld areas of Mpumalanga, and the very far north of KZN. We've had some very good control efforts over the years, and the number of cases in South Africa has significantly decreased. We have lots of visitors going across the border to Mozambique and other countries, and there is significant risk, especially with the season coming up.
Now, early diagnosis and treatment are vital in combating malaria's impact. Maybe elaborate a bit more for us on this. What are the major hurdles that hinder this timely diagnosis, and how can these challenges be effectively addressed here?
I think it's about educating people. You know, having come through COVID and now quite a busy flu season, we recognize that there are overlapping symptoms between COVID, malaria, and influenza. And I think the key message is if you develop fever, body pains, cold shivers, hot sweats, headache, and you live in or have visited a malaria area, you must get an urgent malaria test. Must get the results, and if it's positive, urgent treatment, irrespective of consideration for diseases like COVID or influenza. Think malaria. We need to move it up again. It was moved down during COVID, but we need to move it back so that people are much more aware.
As the major malaria season approaches, what immediate measures can healthcare systems as well as communities take to mitigate the impact of the disease?
Yeah, so the malaria season in southern Africa, we have, a risk of malaria throughout the year, but it's low. And our, formal malaria season starts from September, lasts until May. And most of the cases are seen after the rains or when people travel during the Christmas, early New Year season. So the teams in South Africa in the malaria areas will start spraying houses in those high-risk areas. They spray the walls with long-acting insecticide, and that goes some way to controlling mosquitoes. We need to create awareness, and we need to make sure that people are aware of the symptoms, seek treatment urgently. There's excellent diagnostic tests. There are rapid tests in most of the clinics in the areas or even out the areas. There are laboratory tests, and there are excellent drugs. But we need to make sure that people are treated on the first, the second, or hopefully not later than that, after the development of symptoms.
Professor Blumberg, the One Health approach is emphasized in tackling malaria. Could you elaborate on how this holistic perspective indeed contributes to both immediate responses and long-term management of malaria?
So One Health, incorporates human health, animal health, which is not involved here specifically, but environmental health, and certainly climate. And climate change, increase in rainfall, humidity, obviously very key to mosquito development, and mosquitoes are important in malaria transmission. So I guess the One Health approach would come in there.
So public awareness about malaria appears to have also waned during the pandemic, the COVID-19 pandemic.
Yeah.
What innovative methods can be employed to rekindle this interest and also prioritize malaria prevention as well as treatment?
I think you're absolutely right. During COVID, people weren't traveling as much. I think there was a negative impact on the program, but I think they've now caught up. I think it's really just creating awareness. And I think our discussion here is absolutely key to spreading the word. That's key message. You travel in a malaria area, develop fever, flu-like illness, seek care, tell the health professional that you are concerned about malaria, and patient power, demand a test, a quick result, and access to treatment should follow. Nothing magic.
Yeah, go ahead.
It's straightforward, follow the rules.
Follow the rules. Now, Professor Blumberg, your recent Lifetime Achievement Award is a testament to your impactful work. Could you share some milestones and collaborations that you've significantly advanced in malaria elimination efforts here?
Yeah, so I'll start with the second part. It's always a collaborative effort. Malaria is a public health program. It's always about a team effort. It's not an individual on his or her own. So malaria is a team. People who spray, people who go out and tell communities about malaria, the nurses, the doctors in the clinics, people who write guidelines, people who collect the data and analyze it. It's really a team effort. I think for me, the couple of milestones were the introduction or supporting the introduction of an excellent drug for the treatment of severe malaria. That was quite a challenge, and worked very hard with colleagues to ensure that it was widely available. But we really don't want to get to the stage of severe malaria. We want to get that message out there. And one death is one death too many. And, that's something we need to prevent and work very hard at.
So the ongoing pandemic has also strained healthcare resources. As we wrap up, how can nations ensure a balance between addressing COVID-19 challenges and also sustaining efforts against diseases like malaria?
I think you've touched on a difficult area. Certainly, as soon as you take resources away from malaria, the disease bounces back. And I think it's to recognize that. I think largely the pandemic has receded. I think there have been a lot of scientific developments that have come out of it that could be applied to other diseases. But we need to move malaria up on the agenda. Otherwise, we will go back to where we were, which is really not acceptable. We need to keep our eye on resistance, and we need to keep those efforts up so that we eliminate malaria in our part of the world.
Prof, let me thank you for your time. That's Professor Lucille Blumberg for sharing her extensive experience in the fight against malaria as well, and also talking through the various initiatives